Jones, and I'm the CEO and co-founder of Thera B Medical. I'm here today to introduce our first product, Snuglet, which is the wearable and care-oriented treatment for infant jaundice. Just to start, how many people in the audience have had a child with jaundice or know someone whose child has gone through this? So quite a few. That's exactly what we're here today to address. Jaundice is a condition that affects nearly 60% of all babies. If not treated within the first few days of life, jaundice can cause irreversible brain damage. Jaundice is treated through what's called phototherapy, which is when blue light is shown directly onto the infant's skin. There are treatments available in hospitals today. However, the problem with these treatments is that they're cumbersome, not portable. They cause stress and separation between mother and baby, and they only cover one side of the infant's body. In fact, nurses deal with what they have nowadays, so it's very common for nurses to use 2, sometimes even 3 devices at one time. And as you can see here, it's impossible to hold, bond with, or breastfeed your baby at all during this 3 to 7 day treatment. We created Snuglet as a solution to these problems. Snuglet is a wearable phototherapy garment that allows the baby to be held, comforted, and breastfed during their jaundice treatment. Unlike current treatments, Snuglet provides blue light therapy completely 360 degrees around the infant's body. It's powered by a battery pack. I don't know if you can see it here, but it's powered by a battery pack, so it's perfect for use both in hospitals and at home. And most importantly, it fosters maternal-infant bonding, kangaroo care, and breastfeeding without interrupting jaundice treatment. Almost 2.5 million babies just in the US alone are affected each year from jaundice. We estimate this to be nearly double worldwide. We're starting with the US market as our initial target market, but we plan to move to Europe and other countries after gaining traction. We plan to implement our business through 2 channels, both the hospital channel and also DME or home care suppliers. We've partnered with 6 large hospitals in Michigan who will be our first adopters, and we're currently in the process of forming a partnership with a large medical supplier in Florida who will help us build up that side of our market. TheraB is formed by a wonderful team of well-rounded individuals with experience in engineering, sales, medical device sales, finance, and pediatrics. We formed many wonderful partnerships in the state of Michigan, including 2 active investors with ties to both Michigan State University and the Michigan State Medical Society. But we're not stopping there. We're currently looking to broaden our hospital reach to hospitals in other regions of the country. We're currently in the final stages of product development and hope to submit to the FDA as a Class 2 device by early next year and help mothers and babies in our first hospitals by summer of 2017. Thank you very much.
Thank you.
How much do you expect it to cost? And is this a single-use device, or is it something that like hospital would carry and then disinfect and use again?
Yeah, actually, I didn't mention that part, but we have 2 components. There's the reusable piece, which is the light insert itself, and that retails for about $3,500. And then there's the disposable piece, which is the swaddle itself and a sanitary layer inside, and they all fit together to be one unit. And the disposable piece is about $10 per pack, and we estimate that the baby will use at least 1 per day, because that's for reasons like maybe throwing up on it or wetting the inside or just sanitary reasons. So we do have that razor blade revenue model built in, which the hospitals are already used to from the sanitary layers on their current devices.
Why can't this be used informally? Like, why can't mothers use it, rent it from a local provider, and use it themselves? Why do they have to go to the hospital?
So sometimes they do that. So it just depends on the bilirubin levels. So if it's really high right after birth, sometimes they'll just treat it in hospital. Sometimes the parents and babies are discharged. They go in a few days later for their checkup and the levels have elevated, so they write a prescription and they go to the DME and pick it up and take it home. So both work. It just depends on when the bilirubin levels present themselves and just the doctor's preference.
I'll ask the same question as I asked previously. What does your supply chain look like, and how do you plan to deliver to hospitals across the country?
Yeah, so our first target market is the Midwest, and we've built relationships out there for our first 6 months or a year or so. And then after 2018, we plan to include several distribution networks of medical device distributors. And as I mentioned briefly in the slide, with the DME side of things, we're in works of partnering with a large DME supplier in Florida to help handle that side of things, since we have currently more experience in the hospital side of things.
Can you talk about how you tested the safety of the product?
Yeah, so we're
Specifically the battery, thinking about Samsung's Galaxy,
Yeah.
that same battery.
Yeah, so we're still in the process of doing that, but there are specific tests you have to do. It's a class 2 device, and there's actually standards written for phototherapy from the AAP, so the American Academy of Pediatrics. So we're currently doing, there's battery safety, light safety, biocompatibility, a bunch of standards that are predefined, and those are what we have to meet for our FDA submission, but there's no clinical trial needed for this product.
Why doesn't this already exist? Like, what are the changes in technology that you guys are taking advantage of? Like, it just strikes me as having never thought about this before, but it seems like a pretty obvious and fundamentally better solution than what you showed on the
So we're changing the delivery of phototherapy. Phototherapy itself is just visible light, so we're just changing the delivery mechanism.
Great, thank you so much.